I guess first of all, I work within public health, so clearly I see it as a growing challenge which we in the public health profession ought to be doing, and I feel we've probably been a bit on the back burner around that. We've spent a lot of our time focusing on the traditional health-related behaviours that impact on health, and we've let issues around loneliness and social isolation slip off our agenda. So I'm very keen that that starts to push up the agenda, and I think we've heard today, and I think it's becoming more and more apparent that the evidence is increasingly there to suggest it's as important, if not more important, than some of the traditional things which we've focused on as a public health community. So that's certainly one of the things that I see is how it's of importance directly to the role that I'm involved in. Another one, I guess, is in the organisation which I work in. I think there's a particularly unique challenge there in that I work within the Western Isles Health Board. It has its own particular challenges around its population. So there are challenges around the geography and the ageing population there, and also there's a growing trend towards ageing populations living on their own in single resident households. So all of that combined presents, I think, a particular challenge to communities that are living in remote and rural situations. So I think that's something. It's not to say that communities in urban settings don't have equally challenges around these issues, but they may be a bit different. So that's something that certainly is of interest to me, is to share learning with other folks operating in similar communities with similar challenges as to how we can combat this challenge. As I mentioned earlier, I think we could be doing a lot more, but we have in recent times started making some inroads around this. I mean, traditionally our approach has been within the health service, certainly in my organisation in public health, to support and encourage third sector organisations that may be operating in that area. So we have schemes and initiatives that allow those organisations to seek support through through the health board. So we have supported some local voluntary organisations that are doing some arts-based approaches to social connected initiatives, that type of thing. But I think aside from that, that's kind of been the traditional way in which we've operated in public health, which is fine and valid, and we ought to keep doing that. But I think we as an organisation need to be doing more directly ourselves. So we've started a pilot scheme around social prescribing in one of our more remoter communities, and that's focused. I mean, these schemes are starting to pop up more and more, looking at general health and well-being of populations, particularly hard to reach groups. The particular thing about this scheme which I've set up is that it is specifically focused around social isolation and loneliness needs, because we see that as a priority. And the early signs are encouraging. We've got a lot of stakeholder buy-in, and a key group is our primary care colleagues, and they're very positive about supporting that, and probably will be one of the key suppliers of clients into that service. So that's good. It's early days, and we're hopeful that will deliver benefits going forward. The other area, I guess, which we as a health board try to do is foster more collaborative working, so that we can share the challenges and the initiatives that we are developing with other organisations internationally as well, in terms of particularly the remote and rural challenges which we face and impacting on isolation and loneliness. So we've got a number of projects operating across the EU and the more northern and remote areas where we're sharing learning and participating in joint initiatives around that. So we're very hopeful again that will deliver positive outcomes. I guess the fact that it's taking place is really positive. It's really good to see that at a national level there's the bringing together of people with an interest in operating in this area. So I think that's fantastic, and I would hope on the back of that because there'll be a lot of enthusiasm generated from this type of event. I hope that they take the opportunity to capitalise on that, and there's some plans going forward to do something further around that. even if it's just maintaining the links, the networks, a forum for people to share learning and ideas around what we're doing in our own areas, and then have some kind of coordinated national approach to that. So it's good to see both the upward bringing of what's on the ground with the national and people around the table as well, to see how we can harness that and give some national direction to that. And resources are always good as well, if it encourages nationally some resources around this, because everything always involves some element of resources, and we're in hard times, so that would be useful too.